And like you were saying, too much of anything is obviously bad. You can take too much. Vitamins can be toxic, right? I mean, anything. Sure. So too much testosterone, I'm firmly against that when people are dosing extreme amounts and their levels are too high for too long. Amongst the health implications, it can obviously cause mental implications.
Sure.
But what, and you and I especially, I think we put a ton of time into TRT, testosterone itself, and years upon years. And I don't think that some people that make these comments realize that, one, in extreme cases, low testosterone could be fatal. Sure. And two, an quality of life that you are losing with lower levels of testosterone, it would blow a lot of people's minds. I don't think they understand what people do go through. And it's what makes it's what makes your quality of life as a man, just like as a female. If your estrogen is crushed, you're going to have a lot of problems. And as a man, you would too. But when those are your main hormones, they can really, really make your life a living hell. I've seen it a million times, and I'm sure you have too.
Sure. And
so it biologically doesn't make sense. Factually doesn't make sense. And humanity, it doesn't make sense in reality.
If you even look at, hypogonadism or low testosterone is linked with all sorts of problems, metabolic syndrome, cardiac issues, the list goes on. Obesity, diabetes. And if I just posted today a new paper that just came out. If you go to my Instagram, Rick Collins ESQ, and just look there, I put a link to a new study that finds that low testosterone is linked to anxiety.
I saw it.
Yeah. And they now have identified the biochemical mechanism by which, through a rat study, by which they now suspect that makes that link. So sure, low testosterone is a huge problem. Obviously, too much of anything, taking massive amounts of anabolic steroids is going to make you sick. You're not going to do well with it either in any respect. And I always say that the devil is in the dose, right? The difference between a medicine and a poison is dosage.
Right.
So, if you drink a glass of red wine, if you like a nice Cabernet, some say any amount of wine, any amount of alcohol is not good for you, maybe. But there's also some evidence that maybe there's some cardiac benefits, the resveratrol, the alcohol thinning the blood, whatever your theory, certainly there's a difference between a glass of wine with dinner at night and 2 bottles of scotch every night, so you're going to get very sick and die. And if we used the 2 bottles of scotch as the way we think about the consumption of alcohol, period, which is what we do with steroids, right?
Right.
So the public does, the general public and the medical community thinks that everybody who's using steroids, including people who are legally prescribed TRT, are the equivalent of the 2 bottles of scotch. Right. So, it's a matter of context. And too often in this society, we lose that.
Absolutely. I thoroughly agree.